Hi, CHW Hub. It's Nurse Sarah. Today is November 7th, 2022, and I'm coming to you to talk a little bit about the Tripledemic. So, the Tripledemic is the term that is being used to refer to the collision of three respiratory viruses that are expected to really overwhelm emergency departments this winter. And those three viruses are COVID-19, the flu, and RSV. We've talked already a little bit about COVID-19 and the flu this fall, so we're just going to discuss a couple of updates pertaining to those two viruses, and then we'll chat about RSV and what it is. So some updates with COVID-19. There are two new subvariants, and they're subvariants of Omicron. So far, they do not appear to cause more severe illness, and the updated booster does seem to still be very effective in preventing severe disease and hospitalization with these subvariants. Another exciting update is that the updated booster was approved for children 5 to 11 years old. So that's really exciting news. We can be encouraging folks to get their kids vaccinated against COVID-19. Some updates about the flu. So the flu is circulating already at a higher rate than normal for this time of year. But this year's flu vaccine is proving to be very effective against the flu. Even if you do get the flu, it will be milder and it will not last as long as it would if you had not gotten vaccinated at all. And in the newsletter, I've linked to the vaccine finder so that we can help people find flu shots and COVID vaccines in their area. And now we'll talk a little bit about RSV and what it is. Like we mentioned, RSV is a respiratory illness. It primarily occurs in the late fall through early spring in the United States. Infants, young children, and older adults are at highest risk of getting RSV, but anyone can get RSV. And almost all children will get RSV at least once before their second birthday, so it's very common. Signs and symptoms of RSV have considerable overlap with COVID-19 and the flu. So cough, fever, shortness of breath, wheezing, runny nose and congestion, decreased appetite, and increased irritability are all the most common signs and symptoms of RSV. In an otherwise healthy person, RSV usually lasts for anywhere from 5 to 7 days. People with RSV are typically contagious a day or two before the onset of symptoms, and they're contagious for about 3 to 8 days. Similarly, also to COVID-19 and the flu, RSV is spread by droplet. So you can get it from someone coughing or sneezing on or near you, or from touching a surface that has the virus on it, like a doorknob or a cell phone, and then touching your face before washing your hands. In terms of prevention, we're looking at, those same things that we've been doing for COVID and the flu. Cover your mouth with a tissue or your elbow if you cough or sneeze. Or wear a mask if you know that you have respiratory symptoms. And when we're going out in public into those closed spaces where we're around a lot of people, we should be wearing masks just to protect ourselves and be safe. We should be encouraging the patients that we talk to wear masks when they're indoors, especially if they're around a lot of folks, because you just never know. It's best to be safe. And also washing your hands often with soap and water for at least 20 seconds, or using an alcohol-based hand sanitizer to clean your hands. Cleaning frequently touched surfaces like doorknobs or countertops or cell phones, and cleaning them often. In terms of prevention for children, the best prevention strategies are going to have to do with healthy diet and good sleep. And I've also linked in the newsletter some references for childhood nutrition and good sleep hygiene, and recommendations from the American Academy of Pediatrics on what is appropriate for different age groups. In terms of when to seek medical care, it all has to do with their breathing, right? So, if they have signs and symptoms of bronchiolitis, that's going to include fast breathing, flaring nostrils, head bobbing with breathing, grunting or wheezing while breathing, or belly breathing, which is when the rib cage caves in and forms an upside down V shape under the neck. And I've actually linked a video so that you can see what that looks like. Also, signs and symptoms of dehydration. So, if the baby isn't feeding or drinking the way that they typically do, or if they have fewer than one wet diaper every 8 hours, we're going to want to see a doctor or go to the emergency room. Increased work of breathing, and again, that's that belly breathing that we talked about. Gray or blue tongue, lips, or skin, or decreased activity or alertness. I've linked a lot of resources in the newsletter this week, so please do check those out. Vaccine finders, a very interesting article from the New York Times, a link to vaccines.gov, sleep guidelines and nutrition guidelines for children, and that video about increased work of breathing. I hope you all have a good, safe week, and I will talk to you in 2 weeks. Bye.